Atherosclerosis is a disease in which the wall of the artery thickens as a result of accumulation of lipids, some cells and other particles called atherosclerotic plaques. These atherosclerotic plaques lead to narrowing and occlusion of the arteries. Sometimes rupture of these plaques lead to clot formation and acute occlusion of the artery, like in acute myocardial infarction. And sometimes small particles might dislodge from the plaques and blocks other arteries far away from the narrowed artery, like in the carotid artery. Small particles from the carotid arteries travel to small arteries in the brain and occlude the vessel, causing stroke. Atherosclerosis is a chronic disease that remains without symptoms for decades, and early detection is possible, and with some preventive measures, serious events such as myocardial infarction and stroke can be prevented. Atherosclerosis is responsible for 50% of all deaths in the developed countries. It is a multifactorial disease, and the most important risk factors are genetic tendency, high cholesterol levels, hypertension, smoking, and diabetes. Atherosclerosis causes symptoms at late stages, and it is common that arteries at different sites are affected at the same time. Narrowing or occlusion of a heart vessel might lead to heart infarction or angina, that is chest pain, especially during exercise. It commonly affects carotid arteries in the neck, and small particles from an atherosclerotic narrowing in the carotid artery might travel to occlude a small artery in the brain, and it causes stroke. Stenosis or occlusion of the kidney arteries might lead to hypertension, resistance to medical treatment, and even to renal insufficiency in advanced cases. Arterial blockage in leg arteries can cause pain in walking, called claudication, rest pain, gangrene, and amputation in the late stages. In patients with atherosclerosis, dilatation of the aorta, called aortic aneurysm, is not uncommon. Early detection of aortic aneurysm with ultrasound and timely treatment before rupture is life-saving. It is aortic aneurysm more common in men over 60 years of age who has been smoking for a long period of time. Screening with ultrasound should be used in this group. A duplex or ultrasound examination of carotid, lower leg arteries, and aorta should be used for early detection of atherosclerosis in peripheral vessels. Early detection of this disease in heart vessels is usually done by coronary calcium scoring by CT scanning. In patients with one or more risk factors for atherosclerosis, these tests can reveal early atherosclerosis, and preventive measures at early stage prevent future heart infarction, stroke, and amputation. Depending on the findings on ultrasound and calcium scoring and risk factors, various preventive measures are offered to the patients. Some of these measures are lifestyle changes like regular exercise and diet, refraining from bad habits like smoking, and sometimes prescribing medications for high cholesterol levels, diabetes, or hypertension. These measures should be tailored for each individual. The most important part of the treatment is to prevent the progression of disease by eliminating or treating risk factors or associated diseases like cholesterol lowering, clot preventing drugs like aspirin, angiotensin converting enzyme inhibitors, and beta blockers are frequently used. Lifestyle changes such as eating healthy diet, like Mediterranean type of diet, and doing regular exercise, combined with cholesterol lowering drugs with the aim of having LDL down to maybe 100, and low dose aspirin are the best treatment for atherosclerosis. Sometimes, depending on the severity of lesions and symptoms, catheter-based minimal invasive methods like balloon dilatation and stent placement or surgical interventions are needed. In patients with carotid artery stenosis, apart from the best medical treatment, in some patients, stent placement or surgical intervention might be necessary, especially in those with very severe narrowing of the carotid arteries. Such kind of interventions should be performed by experienced surgeons or interventionists in order to keep the complications related to the treatment at a very low level. Severe narrowing of the kidney arteries might sometimes cause uncontrollable high blood pressure and/or worsening of kidney function. In some patients, stent placement or rarely open surgery is needed for treatment of these stenosis. Aortic aneurysm with a diameter over 5 cm often needs intervention in order to prevent sudden rupture and death. In 60% of patients minimally invasive surgery called endovascular aortic replacement is performed through small incisions in the groin. Catheter techniques and stents are used to insert a prosthetic graft inside the aneurysm. The abdomen is not open and the patients are usually discharged after 1 or 2 days following intervention. Some patients, like 40%, are not suitable for minimally invasive surgery due to anatomical reasons, and in those cases, open surgery is performed through an abdominal incision and aortic aneurysm is replaced by a prosthetic graft. Patients with leg artery disease, interventions are only necessary in patients with severe symptoms such as very short walking distance, rest pain in the feet, or open wound or gangrene. Balloon dilatation and stent placement is the first choice of treatment. Surgical treatment, usually in the form of bypass grafting, is needed in patients with very severe symptoms when balloon dilatations failed or when they are technically impossible.